There isn't any standard of care for WHIM syndrome. There are best practices, but no standard of care. And we find that many of the patients that are referred to us are not getting best practices. They may not be on any drug at all that can help them, or they may be on a drug that can help them, but at a very high dose that creates new sets of problems from side effects. So I think the simple answer to your question is that they should be referred to a specialist in hematology. And even there, many hematologists have never heard of WHIM syndrome and may never have seen a patient or know how to manage them. So, but at the level of the general problems that the patients have, the best subspecialist to treat that would be a hematologist. A lot of reason to be hopeful for patients with WHIM syndrome. There are things that we know about it now that we didn't know when it was first described. The picture is much more complete. There's still a lot more to fill in. But I think we can say for parents that have a child with WHIM syndrome, that child is, even though they're going to be told their child has immunodeficiency, the child has severe neutropenia, that is not a death sentence. In fact, the likelihood that their child will not die in childhood is almost 100%. And that most patients with WHIM syndrome lead relatively normal lives, and that there's a lot of help out there, including help in the scientific community, where we and others in the field are trying to identify better treatments and best practices and develop at some point a standard of care and ultimately a cure for the disease. So I think patients should know that there's a lot of interest, and there are groups working hard to help them. And this is a really good time to bring science to bear on this kind of a problem, because we now have methods for identifying genetic mutations, for diagnosing patients quickly. We have drugs that are showing promise, that are being investigated in advanced clinical trials right now as we speak. Patients should become aware of these trials and maybe help to advance them by joining trials. And we also have new genetic methods for modifying genes so that we can possibly eventually fix the molecular defect at the gene level in the cells that matter in patients with WHIM syndrome. And there's also new approaches that are making transplantation a safer procedure, which would make it more applicable to patients with WHIM syndrome.